We know that it's a difficult time for everybody at the moment, but it might be particularly difficult if you are a carer who is supporting somebody vulnerable, particularly if the person that you care for is finding these times distressing. It might be that you've lost your own self-care routine because you're prioritising the care of other people. It is therefore really important to think about how you manage your own mental health and well-being. If you're managing your own well-being, you're in a better position to support the person that you care for and help them manage theirs. Taking time to do things that might help with your anxiety is also a really good way of modelling to the person that you care for how important it is to do this, and encourage them to try out their own anxiety management techniques. Just like the person that you care for, you might notice anxiety in your bodies, in your thoughts, in your behaviour, and in how you experience emotions. You therefore might like to try out some of the techniques that we've been through for yourself. For example, a breathing technique or a progressive muscle relaxation exercise can help you manage the physical symptoms of anxiety, while maintaining a self-care routine and including things like connection with others, a healthy sleep pattern, and doing things that you enjoy are all positive behaviours that might disrupt the cycle of anxiety. Similarly, mindfulness might help you if you get stuck in a past or future oriented thinking pattern, while a safe place imagery exercise like the My Relaxing Place exercise can help bring a sense of calm to how you are feeling. There are lots of places that you can find examples of these exercises that might be longer or slightly more in-depth than the examples we have used in the videos for the people that you care for. Some good places to look for these are on websites like the Compassionate Mind or the Centre for Clinical Interventions, or on apps like Headspace, Aware, or the Happiness Trap. I will now read through a guided imagery mindfulness exercise to show you what the extended versions of these techniques might be like. This exercise is called Leaves on a Stream and will give you an idea of how we can be with and notice our unwanted thoughts, urges and feelings with openness and without judging them, holding on to them or pushing them away. I invite you to find a comfortable position and either close your eyes or fix them on a spot, whichever you prefer. Get in touch with the experience of sitting on the chair, with your feet in contact with the floor. Now, I'd like you to imagine that you are sitting by the bank of a gently flowing stream, watching the water flow past. Imagine feeling the ground beneath you, the sounds of the water flowing past, the way that the stream looks as you watch it. Imagine that there are leaves from trees, all different shapes, sizes and colours, floating past on the stream. And you are just watching these float on the stream. This is all you need to do for the time being. Now, for the next few minutes, I'd like you to take each thought, sensation or feeling that pops into your head and imagine placing it on a leaf and letting it float on by. Do this regardless of whether the thoughts and feelings are positive or negative, pleasurable or painful. Even if they are the most wonderful thoughts, place them on the leaf and let them float by. If your thoughts stop, just watch the stream. Sooner or later, your thoughts will start up again. Allow the stream to flow at its own rate. Notice any urges to speed up or slow down the stream, and let these be on leaves as well. Let the stream flow how it will. If you have thoughts or feelings about doing this exercise, place these on leaves as well. If a leaf gets stuck or won't go away, let it hang around. For a little while, all you are doing is observing this experience. There is no need to force the leaf down the stream. If you find yourself getting caught up with a thought or feeling, such as boredom or impatience, simply acknowledge it. Say to yourself, "Here's a feeling of boredom," or "Here's a feeling of impatience." Then place those words on a leaf and let them float on by. You are just observing each experience as a leaf on the stream. It is normal and natural to lose track of this exercise and will keep happening. When you notice it does, just bring yourself back to watching the leaves on the stream. Just notice the stream and place any thoughts or feelings or sensations on the leaves and let them gently float down the stream. Now, let the image of the stream dissolve and slowly bring your attention back into sitting in the chair in this room. Gently open your eyes and notice what you can see. Push your feet into the floor and have a stretch. Just focus on the present moment, here and now. If you practice that exercise with me, see if you feel any different to how you felt before we started. It's okay if you don't. Different strategies will work better for different people. So try out a few and remember to keep practicing them so that you get more and more used to how they feel. Your role as a carer is highly valued, especially during these uncertain times. If you've ever been on a plane, you'll know that the advice is always to put on your own oxygen mask before helping somebody else with theirs. In the same way, we want you to make sure that you're looking after your own mental health so that you can continue to provide the best support to the person that you care for. I hope that you found this video useful and that you can continue to remember the importance of looking after your own well-being.